Medication abortion is the process of ending a pregnancy by using medication for a pregnancy up to 10 weeks and 5 days. There are 2 medications that are needed to end a pregnancy. One is called mifepristone and the other one is called misoprostol. Mifepristone is the first medication, and this stops the pregnancy from progressing. It is 1 tablet and swallowed by mouth. Generally, people do not experience a lot of side effects after taking it. However, some may experience some diarrhea or nausea. This could also be related to the pregnancy itself. 24 to 48 hours later is when the misoprostol is taken. This medication helps remove the pregnancy from the uterus. Place 2 tablets between the gum and the cheek on both sides and let them dissolve for 30 minutes. After that, you take a sip of water and swish and swallow the rest. Shortly after this time, you will start to feel some cramping and bleeding, much like a heavy period. Some experience more than others, and the amount of bleeding can depend on how far along the pregnancy is. It is recommended to take a strong amount of ibuprofen and extra-strength Tylenol to help with the cramping. Most of the intense cramping and bleeding will happen within 72 hours after taking the misoprostol, and generally it starts about 4 hours after. But most people bleed for about a week, and it is not uncommon to experience random bleeding for up to 6 weeks. If you do not have any bleeding or cramping 24 hours after taking the first dose of misoprostol, you may repeat this dose. It is normal for the body to react with the temperature, but if you have a fever of 100.4 after taking Tylenol, or if you are bleeding through 2 pads in 1 hour for 2 consecutive hours, or you don't have any bleeding 24 hours after taking the misoprostol, you need to contact a healthcare provider. 4 weeks after taking the misoprostol, take an at-home pregnancy test to make sure you are no longer pregnant. If there is one faint line, wait another week and take another pregnancy test. Most people can tell they are no longer pregnant when their pregnancy symptoms stop.